Hello everyone and welcome to today's webinar on One-Rescuer Child Basic Life Support. There's many similarities that exist between the BLS guidelines for adults and children, but here's some differences between the two. For children, if 2 rescuers are available to do CPR, the compression to breath ratio is 15:2. If only 1 rescuer is available, the ratio is 30:2 for all age groups. For very small children, you can use one-handed chest compressions. And the depth of compression may be different. For children, compress the chest at least 1/3 the depth of the chest. This may be less than 2 inches for small children, but will be approximately 2 inches for larger children. If you are the only rescuer at the scene and find an unresponsive child, perform CPR for 2 minutes before you call EMS or you go back to look for an AED. The AHA emphasizes that cell phones are available everywhere now, and most have built-in speakerphones, so you can call EMS while being with the child. Primary cardiac events are not common in children. Cardiac arrest is most commonly preceded by respiratory problems. Survival rates improve with earlier intervention for respiratory problems. Call EMS and get an AED as you would in the BLS sequence. If you're alone with a child on the scene and you've already ensured the scene is safe, do the following. First, tap and talk loudly to the child to determine if they're responsive. Assess if they are breathing. Gasping does not count as normal breathing. If the child does not respond and is not breathing or only gasping, yell for help. If someone answers, send them to call 911 and get an AED. If there's no one else around and you witness the cardiac arrest, you may go call 911 and get an AED yourself. However, if you did not witness the arrest, perform 2 minutes or 5 cycles of CPR before doing so. Then, feel for the child's carotid or femoral pulse for no more than 10 seconds, but make sure you spend at least 5 seconds doing so. If you cannot feel a pulse, begin CPR by doing 30 compressions followed by 2 breaths. If you can feel a pulse, but the rate's less than 60 beats per minute, still begin CPR. Use and follow the AED as it prompts you to when available, while continuing CPR until the EMS arrives or the child's condition stabilizes. Don't forget, we offer online BLS certification on our site. We encourage you to become certified as soon as possible, whether that be on your own time, through an online course, or through a classroom. So thank you so much for tuning into today's webinar. We will catch you next time.